Which is better, microneedling with PRP and stem cell mix with CO2, or facelift? My skin is uneven, breaks out from time to time, big pores. Started to look tired and saggy about 1 year ago. I want to rejuvenate it and restore the youthful look and glow, but I also want to get rid of the neck fat or skin, not sure what it is. I want the lines from my nose to mouth gone. I do not do well with Botox, as it makes me break out every time with large bumps that won't leave, so that is not an answer. If it costs as much to do a neck lift as CO2 or PRP, wouldn't that be better?
Thank you for your question. You've submitted a question with 2 photos, and you're asking this question about the relative benefits of microneedling with PRP, stem cell with CO2 versus facelift for concerns that you elaborate which basically seems to describe issues with your skin quality in terms of pores, and you want to rejuvenate and restore a glow. You feel like you've been sagging, and you are trying to, I think, really look for what is optimal, because interestingly, you have issues with Botox, which you say causes you to break out. And at the end of your question, you're asking about relative costs if everything between PRP and microneedling versus facelift were to cost the same, or CO2, what would be optimal for you? Well, I can certainly share with you my approach to this type of question, which comes pretty much every day in our practice in different ways. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people deal with facial aging has been a focus and an area that has been an area of significant work in my practice for more than 20 years. I think it's very easy to understand why you are asking these questions, because certainly when people look at themselves when aging, they often look at the skin, and essentially the perception is that things are sagging. And now when you try to do research about what to do about these issues, you can be overwhelmed from the claims made by skincare products like creams, for non-invasive products and procedures, to very extensive procedures. So I help my patients kind of understand the strategy by first understanding what is the anatomic issues, and then try to separate the solutions, or at least customize the solution specific to those issues. So to begin with, understand that facial aging has 2 major components. When you notice the lines, like you mentioned, you were concerned about the lines from your nose to the outer corners of your mouth, and you want those to be, quote, gone. Well, facial aging is a combination of volume loss, and that volume loss has to do with not just thinning of the skin. The skin is only about 2 millimeters in thickness, so what else thins? There's bone loss, there's fat loss, soft tissue. There's a change in the architecture of the face with aging. In addition, there's also laxity. So the connections between the skin and the deeper tissues start to loosen, and therefore there is some sagging. So when you ask about these solutions, well, let's look at how do we approach the issues first from the inside outward. Well, to begin with, when I do an evaluation for a patient and we do consultation, very often one of the first things they do is they'll hold the mirror and they'll pull their skin up and say, "This is what I want." And what we call that is, we call that the mirror lift, and it's what a lot of people do at home. And understand that it doesn't always mean that you're a candidate for necessarily a facelift, but essentially it does help you appreciate the relative elasticity of the skin, as well as the contribution of volume loss. And what does that mean? Well, when you lift upward, you're moving volume from the lower part to the upper part of your face. So one of the opportunities that I find for patients like yourself, and again, this is in the absence of a physical exam as well as not seeing other angles of your face, but one of the things that I find has been really significantly of benefit that's not included in the question in terms of your choices is something called structural volumizing. Now with structural volumizing, what we're doing is we're addressing up to a point the volume loss that's related to both bone as well as fat and soft tissue. By using long-lasting fillers such as Juvederm Ultra Plus and Juvederm Voluma placed in a very specific method at the bone level, we're actually able to restore cheek volume, chin projection, jaw angle definition. And what I think you'll find interesting is when you're concerned about a particular line, it's interesting to see the perspective change when you've restored volume in the adjacent areas. So when you look at patients who have had structural volumizing, they may come in concerned, and you may notice that area that you're concerned about, the nasolabial fold. But when you restore volume in the cheek and the jawline, it actually creates the effect of looking like you added volume to the nasolabial fold when you actually didn't. So consider that as one of the potential solutions for more of the global issue. Now, as far as understanding the differences between microneedling and PRP versus CO2 laser and a face and neck lift, there are really there's a very strong dividing line there. A facelift or face and neck lift is the repositioning of sagging skin as well as the muscle connection between the skin and the underlying facial muscles called the SMAS, or superficial muscular aponeurotic system. Basically, it's a surgical procedure to reposition and restore relationships so that the jowls improve and the neck angle improves and the cheeks are elevated. That's a face and neck lift or facelift. Now, when you describe the procedures of microneedling, CO2 laser, and PRP, we're talking about systems to treat skin quality and to improve fine lines, wrinkles, discolorations. That's the most superficial. And all of those are good options, but a proper examination is necessary to determine what works best for you. The photos are helpful, but a proper examination will reveal the things that can actually be beneficial. Now, a lot of times when people try to do the less invasive procedures first by like working on the skin from the outside only, they often get frustrated because they're expecting more dramatic improvement out of a procedure that only treats a very thin layer and doesn't treat the underlying layers. I've seen this particularly in patients who are dealing with acne scars as well as volume loss who want to try to smooth their skin of wrinkles or like I said, acne scars. But when you put volume underneath, such as in the cheek area, then the benefit can actually be significant and the patients can be considerably happier. So I think that the take-home message here is you've missed one particular category that can be of benefit, that can be useful in the overall treatment plan for you. So understand that you're really comparing a skin procedure with the microneedling, laser, and PRP versus a surgical procedure that's much deeper, much more aggressive when you talk about facelift and face and neck lift. And then added to that, and maybe eliminating the other options, might be to do something like structural volumizing, which can last up to 2 years and really can help restore a lot of the balance in the facial aesthetics and facial proportions. So meet with qualified, experienced cosmetic surgeons and learn about these different options. And I think it's very important for you to just be aware and to really get detailed understanding of outcomes. What can you expect? You know, it's very routine for me to see patients who have tried all kinds of superficial skin procedures, and they finally then get to a point where they then seek me out as a cosmetic surgeon, and then when they hear about this strategy, it makes a little bit more sense, and ultimately we're able to communicate at a level where we're actually achieving what they set out to actually accomplish. So it takes time. So you have to meet with a doctor who spends time with you and learns about your issues and reviews your photos in detail and really gets to the heart of what you'd like to accomplish. Doesn't mean you have to do everything at once, but at least you'll be able to develop a plan. So I hope that was helpful. I wish you the best of luck, and thank you for your question.